Hello everyone, this is Vamshi Krishna. Today we are going to see some of the important points for upcoming staff nurse examination. Mainly in the Telangana, we got the notification from the government. We are going to apply for the government jobs from the 25th January. So I hope you all of you are preparing well for the exams. So we will see some of the important points for nursing recruitment examinations. So first point is barrel chest seen in. So if you see the picture, the man carrying the barrel is nothing but a small drum. So this kind of clinical feature we can see in the case of emphysema. Emphysema is nothing but okay. So emphysema it is nothing but blocking or damaging of the alveoli. Okay, alveoli we can this is the cell of the lung. So when the patient having the blockage or any damage, so abnormal conditions in the lungs, okay, mainly COPD and emphysema. Okay, so in these conditions we can see barrel chest. And the next point is percentage of oxygen in inspired air. Inspired air is nothing but from the environment. So when we inhale the air from the environment, we get the 21% of the oxygen. Okay, so 21% of the oxygen is present in the environment, that we will inhale into the lungs. And the next point is sinus rhythm started. So sinus rhythm is nothing but, if you see the heart structure here, okay, so this is the heart. We can see the SA node here, okay, and electrical signals pathway. So mainly the electrical signals which are made and start from the SA node. Okay, so from the SA node it goes to the AV node, and it will goes to the bundle of His, and then finally Purkinje fibers. Okay, so these electrical impulse are start from the SA node, that is called, it means SA node. Sinus rhythm start from the SA node. And in the brain, the thirst center is located at, okay, in the brain you can see the brain structure here. Okay, so this is the brain, and we have the small structure here, you can see. So this is called hypothalamus. You see the hypothalamus. So this hypothalamus is control the thirst. Thirst is nothing but a drive to drink the water. It is called thirst. So the thirst center is located at the hypothalamus, and we will see some of the functions of hypothalamus. First function is mainly hypothalamus is responsible for the releasing of hormones. So in our body there are different types of glands which produce the different functions of the hormones. So these all hormones are uh, regulated and maintained by the hypothalamus. And the next function is daily physical cycles. Okay, so in our daily activities are controlled by the managed by the hypothalamus, and also controlling of appetite, managing sexual behavior, regulating emotional responses, and regulating body temperature. So these are the functions are controlled by the hypothalamus. And the next point is parathyroid hormone function. So what is the function of parathyroid hormone? Mainly these parathyroid glands you can see here. Okay, so these are the small structures you can see here. Actually this is the thyroid gland, butterfly like structure. Okay, so this thyroid gland is present at the neck region. So back of the thyroid gland we can see two pairs of the parathyroid glands, which which produce the hormone to that is a parathyroid hormone. The main function of the parathyroid hormone is increasing of plasma calcium level in the plasma, okay, in the blood. Okay, so in the blood the calcium level is regulated by the parathyroid hormone which produced from the parathyroid gland. And the next point is heparin. So heparin, you all know, it is an anticoagulant. Okay, so heparin secretion from, okay, so from where the heparin will produce in our body? The answer is mast cells. Okay, so from the mast cells we get the heparin secretion. So mast cells are play an important role in how the immune system responds to certain bacteria and parasites. So in our body, when the bacteria and viruses are entered, so these mast cell will react towards the pathogens which are enter in our body, and also they help to control other type of immune responses. They contain chemicals such as histamine, okay, histamine, heparin, cytokines and growth factors. So these are produced from the mast cells. The next point is the gap between infection exposure to symptom appeared. So what is the name of the gap between the symptom infection exposure? Infection exposure nothing but when the bacteria or virus enter into the body. Okay, when the virus is enter into the body, and after some time we will see the symptoms. Okay, so what is the gap between these two abbreviations? That is called incubation period. So incubation period means the time between catching the virus and beginning to have symptoms of the disease. Okay, so most estimates of incubation period for COVID-19. For example, if you see the COVID-19 range from 1 to 14 days. Okay, so COVID 1 to 14 days of incubation period. This is the important question. You all have to remember in this. And mostly, most commonly around 5 days. But perfectly 1 to 14 days. But in some cases we can see within 5 days of the incubation period we can see the symptoms of the COVID-19. And the next point is universal immunization program start in. So when the immunization program was started, that is 1985. And the next point is Bugs extension belongs to the method of traction. So you can see the traction here. When you people are worked in the hospital area, you can see this type of method in the ortho ward. Okay, ortho ward, it is mainly for the fractured cases. So this Bugs extension traction is a method of skin traction. Okay, so these bandages and all the cotton and ribbons are tied to the skin of the limb. Okay, so it is called skin traction. The next point is lifespan of the red blood cells. So you all know what is the lifespan of the red blood cells, that is 120 days. And the next point is what is the normal intracranial pressure? Okay, so in the brain there will have the CSF. Okay, so cerebrospinal fluid which is present surround the brain. So this CSF pressure is 5 to 15 mm of Hg. So this is the normal pressure of the intracranial. And the next point is what is sclerostomia? Okay, sclerostomia, it is nothing but if you see the picture here, the women have the tongue. Okay, and it look like dry. Okay, so it means sclerostomia. Sclerostomia is nothing but dry mouth or dry tongue. It is called sclerostomia. And the next point is cleaning of thermometer after taking a temperature. For example, if you are going to check the temperature of the patient, okay, so before and after. So after taking the temperature, how you will clean the thermometer? That is stem to bulb. Okay, so this is called stem and it is bulb. So after taking the temperature, you have to clean from the stem to bulb. Okay, why? Because this area is attached to the patient. Okay, so this area is attached to the patient, so it is highly infected and it is not that much infected. Okay, so whenever if you are going to clean the area of the wound or any instrument and all, firstly you have to clean less infected area to high infected area. Okay, so this procedure is done after the taking the temperature from the stem to bulb, and before taking the temperature you have to clean the thermometer from the bulb to stem. Okay, and the next point is cleaning of eyes. So if you got the patient that the patient has the any eye infection or any pus or any foreign body present in the eye, so you are going to plan for the cleaning of eye. So from where to where you will clean the eye? That is inner canthus to outer canthus. Canthus is nothing but the angle you see the beside of the each eye. Okay, so this area is called canthus. So uh, while cleaning the eye, you have to clean the eye from the inner canthus to outer canthus. Okay, inner canthus is nothing but near to the nose. This is inner canthus and this is outer canthus. So you always clean the eye from the inner canthus to outer canthus. The next point is which substance is known as respiratory pigment? So you commonly know this is hemoglobin. So hemoglobin is present in the blood. So it is called as the respiratory pigment. Okay, remember this. Other name for the hemoglobin is respiratory pigment. And what is the fifth vital signs? So we commonly know vital signs are 4, but recently it turns to the 5. Okay, so 4 vital signs are temperature, blood pressure, heart rate, and respiratory rate. These 4 are vital signs, but pain also turned as the one vital sign. So the importance of including pain as a part of the 4 traditional vital signs, those are temperature, blood pressure, heart rate, and respiratory rate. Along with that, pain also the 5th vital signs. And the next point is gambush fish is used for the prevention of. So you see the picture of the a fish. Okay, this fish is used to prevent the malaria. How malaria can be prevented by this fish means when the water, okay, when the mosquito is is lay the egg in the water, these fishes are will eat the eggs and larvae of the mosquitoes. So by eating those, the malaria can be controlled. So these gambush fishes are used for the prevention of malaria. Always remember. And the next point is exophthalmos is seen in. Exophthalmos is nothing but the person eyeball is looking like came out. Okay, so you see the eyeball is almost came out from the cranium. So this condition we can see in the case of Graves disease. Okay, so in the case of Graves disease we can see the exophthalmos. Graves disease is an immune system disorder that result in the overproduction of thyroid hormones. Okay, hyperthyroidism, it is nothing but increasing of production of thyroid hormones. So due to the hyperthyroidism, the person will get the Graves disease. In the case of Graves disease, we can see the exophthalmus. That is condition is protrusion of the eyeballs. Next point is Bishop score. Okay, Bishop score classification is used for. So what is the use of the Bishop score classification? The answer is requirement of induction of labor. Sorry, requirements of induction of labor. So during the labor, so what are the items or requirements are assessed or clinically seen by the Bishop score. So the main function of the Bishop score classification is used for the requirement of induction of labor. You can see the here Bishop score scale sign 0, 1, 2, 3 like that. Okay, so firstly consistency, effacement, dilation and fetal station. So this Bishop score classification is used for the requirements of the induction of labor. And the next point is hemophilia is a condition of. So what is the meaning of hemophilia? Hemophilia is nothing but a bleeding disorder. Okay, so the bleeding from the eyes, mouth, nose, germs, and joint pain, swelling. So all these symptoms we can see in the bleeding disorder, that is hemophilia. Next point is other name for bleeding disorder. So what is the other name for bleeding disorder? That is royal disease. Royal disease is a king disorders. It's like a king disorders. Hemophilia is sometimes referred as the royal disease because it affected the royal families of England, Germany, Russia, and Spain in the 19th and 20th centuries. So the kings are affected by the hemophilia. Due to that reason, the hemophilia is termed as the royal disease. Okay. So in the 1837 and 1901, the England Queen Victoria, who ruled, it believed there's a carrier of hemophilia B, okay, or factor ninth deficiency. Due to the absence of factor ninth, so the person will get the hemophilia or royal disease. Next point is the normal intracranial pressure. So what is the normal intracranial pressure? Intraocular pressure, sorry. So here you can see the eyeball. So inside the eyeball, we will see some water-like fluid. Okay, that fluid consists of 10 to 20 mm of Hg pressure. Okay, that is called intraocular. Intraocular is intra means inside. Ocular means eye. Okay, that is intraocular. So the normal pressure of intraocular means that is 10 to 20 mm of Hg. And the next point is opening of surgical wound edges is called. So in the picture you can see that a surgical wound means the some of the operation has done for the patient, and after they got the sutures. So even the presence of sutures or without the sutures, the surgical wound will be open. It would open after the surgery. That is called wound dehiscence. Okay, wound dehiscence. Wound dehiscence is nothing but opening of surgical wound edges. So dehiscence is a partial or total separation of previously approximated wound edges. Okay, after conducting the surgery, and after they will get the sutures on the wound after some time, that means 5 to 8 days. So after 5 to 8 days, if the wound is open or separated edges, it is called wound dehiscence. Next point is water loss scale is used for sorry, water loss scale is used for the pressure ulcer. So you can see the pressure ulcer over the buttocks region. So by using of water loss scale, we can assess the degree of pressure ulcer, that is decubitus ulcer. The next point is immunization is a type of immunity. So in our body we will have the immunity, okay, that is acquired immunity or innate immunity. So in the acquired immunity, that is natural acquired and artificial acquired. In that again we have the active and passive, okay, and in the artificial also we'll have the active and passive. So what type of immunization? Okay, immunization is nothing but taking vaccines. Okay, so for example oral polio vaccine, that is also present in the immunization schedule. So that polio vaccine is comes under the artificial active immunity. Okay, so immunization, it is a type of artificial active immunity. So the next point is antibodies are produced from. So in our body we have the so many types of antibodies. So those antibodies are produced from the lymphocytes. Okay, a lymphocyte is a type of white blood cells. Okay, WBC in the immune system of most vertebrates. Vertebrates are nothing but mammals like human, animals. So lymphocytes include natural killer cells, T cells and B cells. They are main type of cell found in the lymph. So in the lymph we can find the T cells and B cells. These cells are works against the pathogens which are enter into in our body, and which promoted the name of lymphocyte. Lymphocytes make up between 18 to 42% of circulating in white blood cells. So lymphocytes are present 18 to 42% in our blood, that is WBC. So the next point is herd immunity. So what is the meaning of herd immunity? Herd immunity is nothing but resistance in the community. Okay. So for example, a disease, how much percentage of disease transmitted or how much percentage of disease is controlled or prevented, that is called resistance in the community. This is very important question. Okay, what is the meaning of herd immunity? It is a resistance power. Okay, prevention in the community region, that is called herd immunity. Herd immunity is a form of indirect protection that applies only to contagious diseases. It occurs when a sufficient percentage of population has become immune to an infection, whether through previous infections or vaccination. For example, if in the community region, some people are not affected by the a type of virus or bacteria. So that bacteria, virus, pathogens will not produce any disease for those people, or it may be due to the infection, previous infections, nothing but when the person have got the any infection, so that person will have the antibodies. So when the antigen enter into the body, our immune system will react and produce a specific antibody. So in after some time, in after some days or years, when the same virus or same bacteria enter into the body, those antibodies will react and they will kill the antigen, or it may be the vaccination. Okay, thereby reducing a likelihood of infection for individual who lack the immunity. So when the person have the lack of immunity, they may get for the disease, that is called, okay, resistance in the community is nothing but herd community. And the next point is the only immunoglobulin which crosses the placenta. So you all know IgG is the most abundant antibody in the blood. So immunoglobulins are also called antibodies. Antibodies are proteins. Okay, so antibodies are nothing but proteins that your immune system makes to fight germs. such as viruses, bacteria. So these antibodies works towards the controlling or killing the viruses and bacteria in our blood. When you expose to germs, okay, germs are nothing but virus and bacteria, pathogens. Okay, so your body makes unique antibodies that are specifically designed to destroy only those germs. For example, a type of antigen enter into the body. Okay, the same type of antibody will produce from the body. Okay, so this antibody will react only towards the same antigen. It will not work another antigen, another type of antigen. So the same antigen and same antibody will react towards the same antigen and antibody reaction, that is called pathogenesis. And we can see those are types of antibodies over here: IgM, IgD, IgM, IgD, IgA, IgG, and IgE. So these are types of antibodies we can see in our body. You can take the screenshot for review. And the next point is the normal lifespan of CD4 T cells. Okay, in our body we have the helper cell, and B cells. So what is the normal lifespan? That is 100 days. So the normal lifespan of that CD4 T cells are 100 days. So the next point is, in what condition the CD4 T cells count is decreases? So in the case of HIV, HIV is nothing but human immunodeficiency virus. Okay, that is AIDS. So in the case of AIDS, the person will have the reduction of CD4 T cell count. And the next one is the Kaposi sarcoma. So Kaposi sarcoma is a cause of. So what is the causative organism for occurring of Kaposi sarcoma? That is herpes virus. Okay, this is very dangerous virus. It transmitted through the sexual contact, okay, or close contact. So the herpes can be transmitted through the modes of the transmission, that is vaginal or secretions, so skin to skin contact. So due to this virus, the person will get the Kaposi sarcoma. It is a kind of cancer. And the next point is the organ in the human body which does not contain lymphatic system. So lymphatic system is present all over our body, that is the brain, okay, thorax, all the regions, the lymph nodes will be present only in the case of bone marrow. Okay, so in the case of bone marrow we cannot find the lymphatic system. Okay, in the bone marrow we cannot find the lymphatic system. So this is the end of the class. I hope you understand and be prepared and write the exam very well. Thank you.